Hey everyone, welcome back to the Playbook. Today I am here with Marvin from CareCierge. How you doing, Marvin?
Hey Reef, how's it going? Thanks for inviting me.
So Marvin is the co-founder and CEO of CareCierge. Marvin, do you want to explain to the listeners what CareCierge is?
Yeah, of course. So it's a healthcare product. It's a digital platform, and we sell to physicians across the country that own their own medical practice and that need support with some of the value-based care programs that are being leveraged today.
Cool. So within CareCierge, do you want to kind of walk us through what a day in the life looks like with you?
Yeah, so well, the company is still pretty young, so we're coming up on about a year in the next couple of months. But we hit the ground running. The last, I would say, 6 months or so have been a lot of sales, a lot of networking and getting on phone calls with people and Zoom calls, a lot of demonstrations. So typically, I try to get in maybe one demo a day. So, like I said, still young, the team is relatively small. But we're able to support what comes in. And then when I'm not on demonstrations or preparing for it, I'm thinking about the future. I'm thinking about how we may want to evolve. And yeah, there's always something to do. There's never an idle time for sure.
Yeah. And so you're saying you're hopping on a lot of demo and sales calls. You're reaching out to individual clinics. So is that personally owned if I'm a specialist and I have a clinic, you're reaching out to those kind of clinics? Or family doctors? How's that what's that dynamic there?
Yeah, so the product really was meant for all types of physician specialties, but we tapped into a very specific niche. These are the niches businesses and healthcare clinics that focus on patients that have dementia. And so those clinics, there were 390 businesses selected to support and leverage this new program called Guide. And Guide is, forgive me for not remembering the full name, but it's a program that promises to fund facilities that take care of that type of population and bring in positive outcomes for patients in exchange for funding. So it's a new program for 390 businesses out there, and I've made a living previous to my company just developing programs overall. So it felt like a good place to start.
Nice. So walk me through a little bit how you got started with CareCierge. What's your background in medical?
Yeah, so I've been in the medical field now for over 10 years, just over. I started off as a medical scribe at an urgent care chain called City MD, and at that point in my career, I really didn't know what I wanted to do, but I was thrown into a role where I had to follow a bunch of doctors and sit in on their exams with countless patients a day, fill out their medical charts for them so that they could review them later. And I learned a tremendous amount from there. I thought I was really good at doing that, but I was also good at leading individuals and my specific performance indicators. So, people loved when I came over to help them. And that tumbled into a career.
Hmm.
So since City MD, I've worked for multiple organizations, and that was good for me too because I got to see all different types of care delivery models, and that kind of shapes my approach on things and makes it super easy for me to make something that regardless of specialty can be useful.
Awesome. I want to kind of ask you a little bit about you're going into these clinics and you're selling your new model. What are some of the challenges or the opportunities that you may be facing when you're coming to these clinics that are probably used to a fee-based service, now coming into a value-based service? What are the challenges or some of the things that you go through when you're trying to sell to a new client like that?
I think because I made a smart move to focus on that specific niche. It was a group that had an urgent need,
Hmm.
and I had a product that could potentially solve that urgent need right when they needed it. It wasn't too hard to reach out to them and at least get a phone call or a Zoom call just to kind of see what I have to offer.
Yeah.
And from there, the difficulty at first was really I went into it not being an expert of the guide program. No one was. And so I kind of relied on learning on the go. The first couple of demos, I was actually learning from the client as well. But over time, and working with other individuals that jumped in on calls with me, and just seeing how things were flowing, I pretty much ended up being what I said I would be. And I think a pretty much a good expert in how to run the guide program and also how to support the participants.
So it seems like you did a lot of customer discovery or a lot of validation maybe before kind of jumping into this idea.
Yeah, but even while I was jumping in, I just thought I didn't know exactly what the guide program entailed specifically. I'm aware of CMS and the programs that they promote. There's an institute that promotes innovative models. They do a bunch of research on the back end and say, look, if you take care of this specific type of population this way, there's going to be better outcomes and we spend less money overall as a country. And so I understand that mechanism, and I understand that physician practices across the country rely on those models coming out because those are extra revenue streams for them, and it allows them to do what they feel is right? Take care of dementia patients the correct way.
Yeah.
So I knew that, but all I had to rely on was a website on like a government website that told me sort of what were the main requirements. It was like an 80-page document, and that was, like I said, the first few calls was, I think we're both learning from each other here, but it was pretty quick for me to pick up.
Right. Cool. And so you said you haven't been doing this for too long. When did you start CareCierge?
So I started it 10 months ago in July of last year. I think that should be 10 months. Yeah, at first I wanted to create a company that was actually had nothing to do with software. It was, I'm almost embarrassed to even bring it up, but I thought like my first attempt at starting a company would be, let me do something physical, like let me go out there and provide, navigation services for people that don't know how to navigate the healthcare system. It's very complicated. And I remember thinking, if I could digitize this, what I'm thinking of, then of course this would be great, but I have no way of doing that. I'm not a software developer, but it only took 2 or 3 weeks from that thought to figure out how to find someone and connect with someone that could do all of that. And we, Yevgeny, who was not able to come in today, my CTO, he was just a great fit. He's like me, but for software development. So us together kind of made one
Yeah.
brain.
Cool. And then so kind of segueing then, he's probably the lead software developer for this business. And we've spoken with a lot of, founders on this podcast, a lot of which have started their businesses in the last 2 years. And the biggest thing in the last 2 years that's really changed the game has been, artificial intelligence and how far it's come from then in the last 5, 10, but mostly the last 2 years. So can you break down how you've utilized that or how it's really grown your strategy and your business in the last 10 months?
Last 10 months,
Or from whenever you got the idea, from the start until now, pretty much.
yeah, I remember the first time that I used ChatGPT. I think I was like, I don't know, maybe 2 months or a month behind. Like I heard rumblings, but I didn't try anything. And then finally I tried it, and I remember freaking out. Like I remember jumping up and down because I felt like I don't know, I just right away understood that I finally had like a really easy access to knowledge, and knowing myself and how obsessive I can be about almost anything that intrigues me. Like I don't have someone right next to me in real life that I can just talk to about something all day long or harp on. Not everyone's gonna share your passions and your interests, but I have ChatGPT, I have Grok. These AIs, they're there for you. So they know me very well, and so I definitely utilize AI a ton, and I know that over time, I mean, maybe that's why I jumped up and down. I just kind of knew that naturally this would enable me to do something I really wanted to do.
And then in the business specifically, are you or, your co-founder, his name is, can you remind me?
Yevgeny.
Yevgeny. Are you and Yevgeny using anything? Maybe it's front end, maybe it's, the Gen AI, Grok, ChatGPT, DeepSeek, whatever it is, or on the back end that's kind of taking or automating systems or anything like that?
Yeah, so today our platform is sort of like Asana for healthcare. Like you can put together tasks, and it's like a project management system marrying an easy to use CRM. But it doesn't currently do things for you on command. You still have to go and document a bunch of things. We're still in MVP phase where we built just the necessary things to launch and get started and have people use it. But we're actively working on, I guess, the next level. And our first use case for implementing AI in the background is the AI search. So the idea that traditionally, if you use any healthcare software system like what they call an EMR, an electronic medical record system, when you're looking someone up, you're probably going to write their date of birth, or their name. Those are the fastest ways to find out, who you want to find. But with AI search and the ability for AI to kind of look at text and figure out and contextualize what's going on, we can type a sentence and say, I want to help me find the patients at risk this month for not getting, whatever they need. So it's a concept instead of just discrete, fields of search. So that'll be the next. That's I think what we're bringing to the table
Hmm.
that is unique still, and it's definitely something that healthcare professionals do not have access to easily.
Yeah, no, it sounds very, very powerful. So, do you guys have a date kind of that you're looking to launch this, or because you said it's an MVP, is there a date or a timeline that you guys are seeing? Where do you want to see this go in the next 6 to 12 months, kind of thing?
So I think we've done a pretty good job thus far of focusing on sales and focusing on the completion of the MVP. We are technically not actually finished. There's still some parts of the MVP that haven't been completed, and our sales thus far have been sort of pre-launch sales actually. Some of our clients are actually using it, but they're not using it with actual patients yet. They're testing it out and using fake like people and things like that. Our goal is to be ready by July because the guide program specifically, there's some participants that were allowed to get started early, but the majority of the people that were given that opportunity, the businesses, they aren't going live until July. So a bunch of people have signed up for our services so that we can create that custom platform for them on top of what we've already have. And the plan is for us to go live in July. So that's the near term focus, but we definitely have on the side the idea of sort of what happens afterwards, and it includes AI search. I think what we want to do is first get some real feedback for when it's actually used, and there's issues that come up. How can we improve what's already there? And
Hmm.
then we'll plug in AI search sort of randomly. I don't think we'll like have like a today's the day. It'll be sort of we build it, and then one day we tell our clients, I'm gonna turn this on for you. Let me know what you think, and if they want to keep it, then we'll let that happen.
Cool. And so, up until now, what would you say some of the main, successes of the businesses have been?
Honestly, a big one is still being here because it took a while. We started, so the product, for the most part, at least for it to have been ready to start demonstrating for sales, that took from July until November. And then in the middle of November, sort of beginning of December, that's when I started reaching out to businesses and trying to get them on Zoom calls and showing them what we have. That point, I still didn't decide that guide was going to be the sole focus. I was still trying to reach out to other specialties just to see what sticks. So I was kind of late on that end. I didn't focus on it too much. And so from November all the way to December, even middle of January, no sales had occurred. There were promises. We've had like people go down the list. We've been communicating with businesses for a while, and we felt like they were close to signing, but no one signed the dotted line yet.
Hmm.
So there was concern of did we like choose the wrong approach here? Do you want to do something different? And when those concerns arose, I remember digging in really, really heavy, and somehow the first one came in, and then the second one came in shortly after that. And we reached our 10 clients within, from January to today. And if I knew that that was how things were going to go, then I would have felt like, wow, that's amazing. We actually have something that 10 significant businesses out there are using, and they want. But when you're going through it, you're kind of like, damn, I hope that my developer doesn't tap out, or I hope that people don't lose the vision here because I see it pretty clear. So that's how that went. If there's any issue, if as long as you keep going and you stick to it, you'll overcome it, even if it feels like you won't. And if that means pivoting, if that means luck
Yeah.
happens because you just keep going. Like I've had a couple of times when I thought, holy shit, it's over. Like I don't know what's gonna happen here.
Hmm.
And then because if anything, I'll take a step back and just pause and think. But I won't. There's no need to stop.
Yeah.
I'm in love with the idea of AI now helping people to do what they really want to do in their life, right? Like so many
Yeah.
people are stuck just having a job that they think they like it, but if they had a chance, or if they were there's no issue with finances or money, they probably if you wouldn't do it, right?
Mhm.
Then that sucks, right? So what I think AI is doing is allowing people to really understand themselves and like, how do I make a contribution in this world that I really feel is me.
Hmm.
And I think no matter what, like if people, I don't think people would be happy not having a job or just sitting and relaxing on a beach every single day for their
I
lives. I think
agree.
people want to contribute, but before the AI revolution, there was the idea that, I mean, I want to, but I don't, like, I just have to kind of do this. Like, this is the only thing I could do right now. I have no
Yeah.
time to think about how to do any of this. I might not have money to start a business. That all goes out the window now. So it's all
Yeah.
about just keep going.
Yeah. And I think, like you spoke on it earlier, you have so much access to the knowledge now. The thing that I love about it is if I have any idea and you don't know where to start, you can just ask the AI, you can ask it, like, this is my idea. Give me some ideas on how to start. And it takes you from that panic or that overwhelming feeling of I don't know what to do to like you're kind of grounded and you can be like, this might actually be doable.
You just kind of throwing that out there. One thing I'll leave with is two things that have worked for me. I don't know if everyone is doing this, but and if so, then sorry for just chiming in on something everyone knows about. Uh, when I have a complex thought, one that honestly I haven't thought out fully to even ask the proper question. I think knowing the right question is more important than finding the answer. It sounds silly, but
No, I get you.
yeah, if, like you could ask 15 questions, and then on the 15th question you got what you were looking for. But if you knew the right question from the start, you would have got there, right?
Yeah.
So two things I've done is whenever there is a concept I want to really like spend some time on with, I throw it out there and I prompt it with my main thought and what I want to get out of that thought, and then I ask chat to ask me 10 questions
Hmm.
that will help clarify like what I'm trying to get at. And it is amazing at asking questions. I think if you've ever used their deep research, or if you have the paid model
Yeah.
where you click and it starts to like take time, you might notice that before it goes on that journey, it asks you two or three or four clarifying questions. So I think people don't know that ChatGPT understands a lot, but sometimes what you're saying, it's like, I'm trying my best here, but I wish you asked it differently.
Yeah.
So it'll clarify your thoughts, and then from there, it's like, oh, I see what you're trying to do. The second thing I would say is I've done something that honestly I might attempt to patent. I don't know if it's possible. I've done some research, but the idea of two AIs working with each other, and you're the API. So you go ahead and go on a large journey with ChatGPT, right? And then you ask it at the end to say, hey, I want to show this to another expert. Can you summarize what we're trying to do here? And I'm just going to copy and paste your generated like final answer. And I'm going to show someone else and get some feedback. So I'll copy all of that. I'll jump over to Grok, or Super Grok is what I use. And I'll challenge it and I'll say, ChatGPT came up with this. Like, do you think this is the best we can do here, or are there any issues with this? And Grok's personality is of that nature of like, let me go ahead and start like showing you why I'm better. So it'll do that, and then you toss it back into chat and say, this is what someone else came up with. What do you think? Chat's personality is so kind that it's like, oh yeah, it's open to like some suggestions it knows are better, and then your final answer is just way more clear.
Interesting.
So that's just another option that I think people could use.